Hello my friends, welcome here. I'm Amy Esther and I live with multiple chronic illnesses, and I have been seeing an upper cervical chiropractor for a few years now, and today I wanted to do an update on how that's going. I'm really excited for this update. It's a good one. So first of all, I haven't talked about my upper cervical chiropractic adjustments in a while, and you may be wondering what even is an upper cervical chiropractor. I will link some stuff down below that will explain a little bit better, but from my experience, an upper cervical chiropractor is much different than a regular chiropractor. An upper cervical chiropractor only focuses on the top two bones of the spine, and it is a very gentle, you don't even really feel it adjustment, and it's hard to explain without actually being there. Most people get very confused when I talk about it. So look it up if you want more information about what it is. But basically, my top two bones, my atlas and axis bones, the bones should sit like this, the atlas and axis bones. Mine were twisted, one going this way, one going that way. We believe it's from a car accident I was in when I was about 16. At the time, I started getting migraines, but I didn't connect my migraines to my car accident. And my chiropractor had told me that the way that my bones were placed, according to my x-ray, shows that there was some sort of accident, or it wasn't just from regular life. You can have your atlas and axis bones thrown off by, looking at your phone a lot, from maybe certain exercise. Like, there are ways, just normal life, but the way that mine was, with both of them going different ways, they said was probably some sort of accident. So that's what it probably was. So the reason that I went to an upper cervical chiropractor in the first place was because I have multiple chronic illnesses, lots of pains and problems. I sometimes just kind of lump them together, but I had talked to someone who had done upper cervical care and recommended one of the chiropractors that I started seeing, which, if you're interested in who I go to, if you live in the area, or maybe you are willing to travel, I live in Utah. My email is linked in the description of the video. If you want to email me, I'm happy to send you the information about the two upper cervical chiropractors that I'm going to talk about today. All right, back to the story. So the first one was recommended to me, and he used what I don't exactly know what it is. I Googled it, and I think it's called an Atlas orthogonal instrument, but again, I'm not the expert, so ask an actual upper cervical chiropractor. But he used this kind of machine that has what looks like a little needle. So the chiropractor would do an x-ray to see where my adjustment needed to be and have me lay down, make sure we have the right angles and stuff. He did all of that. And a little tiny poke, I didn't even feel it. And the very first time I got adjusted, I sat up and I didn't feel that different. But as time went on throughout the rest of the day, I got sicker and sicker, where I felt like I had the worst flu of my life, just every flu type symptom, achy, fatigued, nauseous, dizzy. It was so weird, and I had a really long drive home. So this chiropractor was about an hour away from where I live. And I drove all the way home, which I realized after I should not have done. I should have had someone drive me. I didn't realize how dizzy I would be, but somehow I did make it home. After that, I did have people drive me because I would get so sick after these adjustments. But I drove an hour home, got out of the car, and I couldn't even walk straight. So my neck had been off center for so long. It had been like 12 years of having my bones twisted, which kind of threw off my whole body and my center of gravity. So when it got fixed, I couldn't even walk straight. And I was so dizzy and sick for the rest of the day. When I started with care, he told me that it should be about 3 months of care before my corrections should be holding. Because what happens is my neck was used to being like this, and then when he puts it back together, my bones naturally wanted to go back to the old position. So he recommended doing twice a week for a while. Once that started holding, once a week, every other week, and so on, until it was holding, all the time, and just needed rare occasions to come in and get adjusted. And he said most of his patients, within a few months, they're holding pretty well, and it's only, once or twice a year they have to come in and get adjusted. That did not happen for me, unfortunately. Mine would go out so often, sometimes weekly, Sometimes it would go 2 weeks, and that was like a long time for me. And this happened for 2 years. Every time my correction would go out, I would get the worst migraine. And it was very annoying because my chiropractor was an hour away from my house, so that meant an hour there, an hour back. I also at the time had 2 young kids. Every time I got corrected, I had to wait 24 hours to lift my kids because it was more likely to go out in those first 24 hours. And it was so frustrating because then a week or 2 later, it would go out again, and I just have to go back and start the whole process, have someone drive me there, have someone watch my kids. It would be pretty much a 3-hour thing every time. So gas and the time was annoying, but also it just got so dang expensive. And I started to get so frustrated. But when it stayed in, it helped. And when it stayed in, I felt better. And when it stayed in, I stopped getting migraines. And I knew it was working. And so I would flip-flop between just wanting to give up on it, but then knowing it's actually doing something. And so I'd keep going. I have multiple chiropractors in every city between here and my upper cervical chiropractor, but none of them do upper cervical. So I had to keep going out there. Finally, I found someone closer. She started a new practice. It was only about 30 minutes away from me, and my family and my husband's family live about 15, 20 minutes away from us. So it was on the way. I could drop the kids off and then go to my appointment. It worked out so much better. But then it was a whole new expense because I had to get new imaging. I was starting over with a new chiropractor, so that was a little stressful and overwhelming. And finally I decided to just do it. And I started with this new chiropractor, and it was the best decision for me. So this chiropractor did what's called the Blair method. And I don't get it. I do not understand how she does it. She literally is magic in my eyes, but she does it by hand. So instead of having tools and stuff, she somehow does it by hand. And my first upper cervical chiropractor would just adjust one side. So I think the idea was, even though my 2 bones were both going out, if you adjust one, it should fix the other. I think that was the idea of how it worked. But with this chiropractor, she would adjust each bone individually and somehow do it by hand. Somehow I felt nothing when she would adjust me. It's seriously wild and blows my mind every time I go. But the first time I got adjusted at her clinic was so weird because I did my first adjustment on one side, she flipped me over and did the other side, and I sat up, and the weirdest feeling, but my entire head went ice cold. Like, it felt like someone put an ice pack onto my skull, like underneath my skin. It's the weirdest feeling. It happens every time I get adjusted on that particular side. I don't know what it is. She said it's normal and that it happens a lot. Blood flow or something. I don't know. It is so weird. But I feel nothing in the adjustment, and then I sit up. I'm dizzy and my head goes ice cold. My adjustment did go out occasionally, about once a week, and I was still getting frustrated. Like, okay, I just paid all this extra money to have new imaging, and now this place was actually more expensive than my original chiropractor per visit. And so I was like, okay, is this worth it? Is it gonna work? And I got a little stressed about it because at first I was still having my correction go out a lot. And she reassured me that after about 3 months, everything should be good and I should be holding, which is what the other chiropractor said. And you know me, if there's an exception to the rule, it's me. Now, normally I'm not the norm, but this time it actually worked. It wasn't maybe 3 months. It was probably 6 months until mine was consistently holding, but I have not been adjusted since September. It is now January. September, October, November, December, January. So it's been 4 months since I got adjusted, which is wild. That's the longest I've ever gone, I think. So migraine update, I still occasionally get headaches and migraines. I probably have a little headache almost every day at some point, but the migraines I used to get where I couldn't open my eyes, I was so nauseous. I even have gone to the ER before because my migraines were so bad, and I would get the migraine cocktail at the doctor's office and it still wouldn't help. And I would just be so freaking miserable with my migraines. I don't get those anymore. I still get the occasional migraine if maybe I didn't sleep well, or maybe I didn't eat well or didn't have enough water. Like, those still come up. But it is so much better. It is so much more manageable. The migraines I get now, I have some caffeine, ibuprofen, Tylenol, and I'm good. I can handle it. I can take care of it. When before I could hardly function every time I got a migraine, and it just ruined everything, and I couldn't even take care of my kids. Well, I am just so excited to say that my corrections are finally holding. For me, I needed the Blair method. I know my first chiropractor has had so many success stories, so many people who it's worked for them. I, of course, as per usual with Amy Esther and all of her health problems, I am the exception to the rule. I needed a little bit extra. I needed both sides adjusted. Surprise, surprise. I needed it done by hand. I needed it done a little bit different, but it worked for me. Now, I know my chiropractor told me before, there's not a lot that do the Blair method. I think it's starting to become more common. You'll have to look it up in your area. And again, if you live near me, I'm happy to send you the information to the 2 chiropractors that I used. Just send me an email. It's linked below. My correction will still probably go out at some point. If I lift something weird, or I don't know, anything could happen. Could still go out. So I will still probably go every once in a while, but we are in maintenance mode now, which is so exciting. Anyway, my friends, if you live with chronic illness and you want to learn how to live the most amazing life when you live sick and in pain all the time, make sure you subscribe to my channel, and I'll see you on the next one. Bye, my friends.